and Mariannette Miller-Meeks. They sit on the committee that released this report, and they join us now. Good morning, ladies.
Good morning.
Good morning. Congresswoman Malliotakis, what did you find?
Well, what we're finding is that the Biden administration is continuing to erode the public's trust. In this case, they're allowing the tail to wag the dog, and verbatim, if you compare what the union recommended for the guidance and what the CDC ultimately used, it is literally plagiarism. This is not an issue of following the science. This is an issue of following the influence and the money of the largest union in the country. $43 million donated to President Biden and Democrats and liberal groups throughout the country, and they have this amount of influence where the CDC is supposed to use medical science to determine their guidance and recommendations to the American public. And this is exactly why the people in this country do not trust this administration or the CDC with the mandates and the recommendations that have come out.
Sure. Congresswoman Meeks, you know, what she just said essentially validates the fact that the administration was bowing to one of their largest donors, and they had the donors actually writing the law, and ultimately the teachers didn't want to have to go back to school, and the administration helped them out.
Well, I can tell you as a physician and a former director of the Department of Public Health that it's not unusual to bring people together and to convene individuals as you develop policy, but to have emails prior to the release of this document, prior to the release of the guidance, as Representative Malliotakis said, that are almost verbatim.
Yeah.
As a physician, if I did this in a medical review article, I would have to disclose financial disclosure and conflicts of interest. At least they should have footnoted the teachers union.
Right. It's too bad Anthony Fauci didn't step in and realize how wrong that was and step up and try to embarrass the administration like he did the previous one. CDC said this to Fox. CDC has traditionally engaged with organizations and groups that are impacted by guidance and recommendations issued by the agency. The strength of this guidance resulted in 99% of schools being open and children being in the enriching environment of a classroom during the Delta surge in the fall of 2021. Okay, that explains it. Those kids stayed out of school with the faulty information between 6 feet apart, which prevented them from going 3 feet apart. And then the teachers were too scared to go to school for a while. Little did we know, remember, Congresswoman, when one was actually on vacation on the islands while she was doing her remote teaching. So this is a train wreck. But we kind of knew about this already, didn't we?
Well, remember that billions of dollars went to the schools in order to prepare them. We put teachers at the top of the line for vaccinations so we could get kids back in school. And Iowa was a great example. Did they contact the Department of Education or Governor Reynolds in Iowa? Because we reopened schools in August of 2020. So they could have gotten information from Iowa about how safe it was to open schools, because we didn't have incidents, we didn't have super spreader events. But they didn't contact Iowa. This was, you know, a teachers union who, as you said, the unions gave $43 million to the Democrats, to Biden, to their causes. And then you have a document that is almost verbatim with what the teachers unions wanted to do so that schools would not reopen. And it did immeasurable harm to our children, both in learning, their mental health, their anxiety, and even suicide as young as 9 years of age.
Congresswoman Malliotakis, the bottom line is we trust the CDC. It's the Centers for Disease Control. We look to them for our health and to find out how we're supposed to react to certain diseases and illnesses and things like this. So for them to listen to the teachers union and not the doctors and not the science, what else are they telling us that's false information?
And my concern is that's what the American people are concerned about. Look, the reality is they're following the political science, not the medical science. And if they want to, have the American people trust in their advice and their guidance and their recommendation and ultimately their mandates, then we must make sure that this organization is run by somebody who's not going to be influenced by political outsiders. And so here in New York City, we're the opposite, unfortunately, of Iowa. And our children's suffered greatly over the course of the last 2 years because Mayor de Blasio is also somebody who is influenced by political outsiders, by those who contributed to his campaign instead of the medical science. I think the president needs to reevaluate who's running his agencies across the board because they've eroded the public trust, whether it's the border, whether it's the CDC, whether it's those who oversaw the botched withdrawal of Afghanistan.
Sure. And last night, the administration fired Dr. Oz, who sat on an advisory board because he
was the problem.
Yeah.
Right. And Herschel Walker fired.
Anyway, Congresswoman, thank you very much for joining us live.